Welcome and thank you for joining the 2020 Houston Area Parkinson's Society Summer Lecture Series July session. Since 1974, HAPS has been the only organization in the area providing comprehensive services to the local Parkinson's community. Our mission remains the same since we started, to ensure that no one faces a Parkinson's diagnosis alone. I'm excited to welcome you to the 10th annual Summer Lecture Series. In previous years, we have hosted this event in person rather than using the virtual platform we're using this year. If you're familiar with this educational event, you know that our Summer Lecture Series is an opportunity to provide serious educational content in a relaxed environment with a fun summer theme. While it loses some of its effect virtually, we decided to commit to the theme and to have some fun, which explains all the decorations, Hawaiian shirts, etc. Before we get started, I have several groups to thank. First, I want to thank our Board of Advisors and Medical Advisory Board for their ongoing support and role in developing and implementing all of our educational programs. I want to thank members of the HAPS team, Celeste, Maggie, Angelica, Ginny, Madeline, and Catherine, for all of their effort that they put into this and all of the HAPS programming. I'm fortunate to work with wonderful people who all share the same passion and dedication to the Parkinson's community. Third, I want to offer a sincere and big thanks to all of our sponsors. During a time when funding is critical and hard to come by, this group has remained steadfast in their commitment to our local Parkinson's group and to helping us ensure continuation of our mission. Specifically, I want to thank our presenting partner, US World Meds, as well as Acadia, Accorda, Amneal, Boston Scientific, Medtronic, Synovian, UCB, and Lundbeck. We remain grateful for their generous support, and we are proud to consider them partners in the work that we do. Next, I want to thank our Parkinson's community for sticking together during times of uncertainty. We know that this pandemic has been and continues to be difficult. You all have shown great resilience and patience, especially as the crisis at the local level continues. And finally, I want to thank our presenters for sharing their time and expertise today, helping us gain a better understanding of aspects of the disease and for getting us up and moving after this lecture. Okay, I'm going to do a quick rundown of the day. First, you will hear from our speaker, Dr. Olga Waln, who will then join me for a question and answer session after the presentation is finished, but before we join Pat Johnson for exciting movement lab featuring boxing. If you do not already have the handouts, you can access them on the HAPS website at hapsonline.org under the Summer Lecture Series section. The program includes the full presenter bios, upcoming HAPS events and programs, information from our sponsor, and the presentation for this lecture. There will be at least one brief break as we get set up for the other aspects of the event, and in advance, I thank you for your patience with that. During the question and answer session, we will be addressing the questions that the audience submits through the course of this lecture. If you're participating in the live session, you have the option to submit questions through the Q&A button at the bottom of your screen. We will only be monitoring the Q&A and will not be monitoring the chat or raise your hand features during this program. Okay, now let's get started with what you are all waiting for, and I'd like to introduce our featured presenter. Dr. Olga Waln is a fellowship-trained movement disorder specialist practicing locally at Houston Methodist Neurological Institute, assistant professor of neurology at the Weill Cornell Medical College, and adjunct assistant professor at Texas A&M College of Medicine. She is the author of numerous scientific publications and a member of the Houston Area Parkinson's Society Medical Advisory Board. We welcome Dr. Waln.
Good morning, everybody, and thank you for joining us on this hot Houston day. It's a little bit strange for me to talk to you without looking into your faces, but I'm glad you're here. I'm happy to share with you this important topic. It's called orthostatic hypotension in Parkinson's disease. This topic is very important equally for patients and caregivers, so let's talk about it. So first off, what is orthostatic hypotension? Hypotension is a medical term meaning low blood pressure. Hypo means low, tension means pressure. Orthostatic is a medical term for something that happens in upright position. So therefore, orthostatic hypotension means that your blood pressure drops down when you change your body position from lying down to sitting, or from sitting to standing. So this is what orthostatic hypotension is. Let's talk about why somebody might have orthostatic hypotension. Let's talk about how blood pressure is normally regulated in your body. So normally blood pressure is regulated by reflexes in the nervous system. Blood pressure depends on many factors, mainly on how fast your heart is pumping, how well heart is pumping blood to your blood vessels. Blood pressure depends on amount of blood that circulates in your blood vessels. And finally, blood pressure depends on how hard blood vessels are pushing on the blood that is going through them. We call it resistance of blood vessels. Blood pressure is never the same throughout the day. So you do have some changes in your blood pressure depending on what you're doing. Your blood pressure can go a little bit up when you're under stress. It can go a little bit up when you're physically active. On the other hand, when you're at rest, you're resting, you're calm and quiet, blood pressure tends to go a little bit lower. Normally, body can adjust your blood pressure in response to the demand, in response to any stimulus. So for example, body can change your blood pressure if you transition from being at rest to going to being active. So body also can adjust your blood pressure when you change body position. When you stand up or when you lay down, body can automatically, without you knowing so, body can adjust your blood pressure. Blood vessels are probably the most important factor in adjusting your blood pressure when you transition your body from sitting or standing or from standing to sitting. So blood pressure can dilate or constrict to adjust body flow to certain body parts. So for example, when you eat a large meal, you need more blood going to your stomach. You need to digest and absorb all those nutrients you just consumed. So therefore, your body will dilate blood vessels around your stomach to send more blood to that area. When you are outside and it's hot, or when you're outside and it's cold, blood vessels in your skin also can adjust to allow more heat or less heat leave your body and prevent you from overheating or from freezing. So most patients with Parkinson's disease actually have normal blood pressure or sometimes even elevated blood pressure that would be usually unrelated to Parkinson's disease. However, up to 30% of patients with Parkinson's disease might develop this condition called orthostatic hypotension. Orthostatic hypotension is more common in older patients with Parkinson's disease. It is more common in patients with longer duration of Parkinson's disease, in patients who are on higher doses of Parkinson's medications, or in patients who also take medications to control their high blood pressure. There's one condition that I will briefly mention. It's called multiple system atrophy. It is somewhat similar to Parkinson's disease. It has the same motor symptoms, slowness, stiffness. However, patients with this condition develop severe orthostatic hypotension in earlier stages of the disease. We will not spend much time talking about this condition, but I just wanted to mention that because this condition also has severe orthostatic hypotension as a part of the syndrome. Now, why patients with Parkinson's disease have orthostatic hypotension? Parkinson's disease is nervous system disorder. In this condition, nervous system reflexes can be abnormal. It means your body cannot regulate your blood vessels and blood flow as good as in people without Parkinson's disease. So in Parkinson's disease, blood vessels often cannot constrict or dilate on demand to adjust to changes in body position. Parkinson's medications, many of them, also can decrease blood pressure. Finally, many patients with Parkinson's disease experience nausea, often due to Parkinson's medications. When you feel nauseous, you often don't eat enough. You often don't drink enough water. And if you do that, then you will have less blood volume circulating through your body. It means your blood pressure might be lower because you are dehydrated or because you have vomiting that comes with nausea. Now, how do you know if you have orthostatic hypotension or not? So if you have the symptoms, if you feel that you are about to pass out or you actually pass out when you stand up or sit up, if you feel dizzy, if you feel lightheaded when you stand up, if your vision gets blurry or darkened, if you feel weak all over and your legs are shaking when you stand up, if you feel like you're in a fog or you have chest pain when you stand up, you might be having orthostatic hypotension. If you have the same symptoms of dizziness, weakness, when you not just stand up, but when you exercise, or after you eat a large meal, or after you drink alcohol, or after taking hot bath, you also might be having orthostatic hypotension. Why? Because after all these activities, your blood vessels dilate, and it means that your blood pressure might decrease. When you work outside and it's hot, like today, blood vessels also dilate. If you feel dizzy, you might be having orthostatic hypotension. When you wake up in the morning and you feel dizzy, you also might be having orthostatic hypotension. Why? Because in the morning when you wake up, we are naturally dehydrated a little bit. We don't drink at night when we are sleeping. Therefore, when we wake up, we often have lower volume of blood circulating in our bodies. So if you have any of these symptoms after these activities, you might be having orthostatic hypotension. Now, how can we check if you have it or not? Well, obviously, we need to check your blood pressure, and I will tell you how you should be doing that. If you suspect you might be having orthostatic hypotension, lay down, wait for about 5 minutes or more, and then check your blood pressure. Write down the numbers, both numbers. After that, sit up, wait for about 2 or 3 minutes. Don't check your blood pressure right away, but after 2 or 3 minutes, please check your blood pressure and write down the numbers. Now stand up if you can, wait for about 2 or 3 minutes and check your blood pressure again. Write down all these 3 numbers and look at them. See if your blood pressure is changing. See if your blood pressure is dropping after you sit up or after you stand up. If your blood pressure drops down by 20 points of systolic, that's the top number of your blood pressure, or if your bottom number drops down by 10 points or more, yes, you do have orthostatic hypotension. You might not even feel any dizziness if your blood pressure doesn't drop down below 100 systolic. If it drops down below 100, you're most likely to have the symptoms. Let's look at these 2 examples. So this is our first patient whose sitting blood pressure is 157 over 87. Then patient stands up and checks his blood pressure again. This time is 115 over 79. Patient doesn't feel anything. Patient doesn't feel dizzy or might be feeling just a little bit weak because his blood pressure did not drop down below 100. But just look at these numbers. His top number dropped down by 42 points. It is significant change. It is significant drop. And this patient has orthostatic hypotension. And we will talk about why it's important and how we can deal with that. So this is our second patient whose sitting blood pressure is 114 over 76. Patient stands up, check his blood pressure. This time it is 86 over 54. It is significant drop. And look, his standing blood pressure is less than 100. This patient has orthostatic hypotension. This patient most likely would feel dizzy when he stands up. So I also want to mention here that blood pressure can go up when you lay down for a long time. Just for the same reason, your body cannot regulate your blood vessels. It cannot regulate blood pressure when you change position. This condition is called positional or rebound hypertension, means your blood pressure goes up when you change your body position. So sometimes we have to order so-called tilt test. It's a special test that also can confirm orthostatic hypotension. We don't order it that often. Usually just checking blood pressure is enough for us. But if you cannot stand up, or if we check your blood pressure sitting and standing and the numbers are kind of equivocal, but your doctor has concern that you might be having orthostatic hypotension, we can order this test and we can check your blood pressure while tilting this table and moving your body from lying down to almost like standing position. So why it's important to know if you have orthostatic hypotension? Why are we even talking about it? Can it affect your life? Can it affect your quality of life? Absolutely. If you have orthostatic hypotension, you might feel tired. If you feel tired, you might avoid many activities. You might be able to walk. You don't have any weakness in your legs, but you prefer wheelchair because you feel dizzy every time you stand up and you try to walk. You stop exercising, and that is bad for Parkinson's patients. You cannot exercise because you feel dizzy. You would like to, but you just cannot. You might stop driving, and that can affect your independence. You feel dizzy every time you are behind the wheel, especially when it's hot. And finally, your doctor might be afraid to give you medications appropriate to treat your Parkinson's disease. Because like I mentioned, Parkinson's medications can worsen orthostatic hypotension. So therefore, doctor might be willing to give you higher doses of Parkinson's medications to treat your slowness and stiffness, but it might be impossible because your blood pressure is already dropping down. Orthostatic hypotension might be even dangerous. You might pass out, you might fall, you might injure yourself. You might not even know you have this orthostatic hypotension, therefore you might stand up too fast and nobody will be around. You might fall, so therefore orthostatic hypotension might be dangerous. Now, what can we do if you have orthostatic hypotension? The first thing we always want to do is to look at the list of your medications to see maybe we can change something. Maybe we can adjust the dose of your medications. Maybe we can stop certain medications and change them to different ones. So there are quite a few medications that can affect your blood pressure and can make your orthostatic hypotension worse. Obviously, medications your doctors prescribe you to treat high blood pressure, they can decrease your blood pressure too much. And then those medications might need to be adjusted, those might need to be decreased. Water pills or diuretics, they can decrease amount of blood circulating in your body. And those medications also can cause or worsen orthostatic hypotension. Some heart medications outside hypertensive medications also can decrease your blood pressure, such as nitroglycerin. Some medications doctors might prescribe for prostate enlargement or bladder dysfunctions. Medication like tamsulosin also can contribute or cause orthostatic hypotension. And finally, most Parkinson's medications also can cause or worsen orthostatic hypotension. So what can you do if you have orthostatic hypotension to decrease your risk of falling and hurting yourself? Avoid standing when it's hot outside. Avoid standing for too long. So if you have to stand and it's hot, have a fan with you. That can help you a little bit. Make sure you're well hydrated, especially when you go outside. Always have a bottle of water to drink to make sure that you stay well hydrated. When you stand up, do not do it too fast. Stand up, wait for a little bit. Don't start walking right away. So make sure that you don't feel dizzy before you move away from the chair. This is your safety zone. If you like to be outside, please do it, but avoid going outside when it's too hot. If you like to walk outside, that is perfectly fine, but maybe consider having a little chair with you that you can use to sit down if you suddenly feel dizzy. So just look at the picture of this cane. It's a little cane with a seat you can use if you like to go outside and walk. If you feel dizzy, open this chair and sit down. Rest for a little bit, have some water, then you can stand up and continue your walk. When you sit for a long time, avoid crossing your legs. That also can cause decrease in blood pressure when you suddenly stand up. So all the simple measures, they can decrease your risk of falling from lower blood pressure and from hurting yourself. Remember them. So there are a few other points I would like to discuss with you. Like I mentioned earlier, if you eat a large meal, more blood will go to your stomach, and that will decrease amount of blood that goes to your brain. That can cause dizziness. So therefore, patients with Parkinson's disease should not eat large meals very high in easy sugars, because that can decrease your blood pressure. Eat small but frequent meals. Substitute candies with fruits, so eat more fruits, eat healthier food. So avoid or reduce amount of alcohol you consume, because it also can dilate your blood vessels and decrease blood pressure. It is perfectly okay to have some coffee in the morning. That can increase your blood pressure, unless you have some other contraindications from standpoint of your heart. If your heart doctor is okay, you can add a little bit extra salt to your breakfast and lunch. That also can increase your blood pressure a little bit. But before doing so, please check with your medicine doctor or your cardiologist. Make sure that you drink full glass of water when you wake up in the morning, because remember, you're a little bit dehydrated when you wake up. And do it before you get up from the bed. Have water at your bedside. We do recommend that patients with Parkinson's disease drink at least 3.5 pints of any fluids per day. It can be water, tea, or low sugar juice, anything that you like, but make sure you stay well hydrated. If you exercise, if you're active, if you sweat, you might need to add a couple of glasses to this amount. If you have to sit for a long time, if you are in a plane, on a plane, if you're in a theater or riding a car, so you know that if you sit for a long time and after that you stand up, your blood pressure most likely to go down. So if you have to sit for a long time, do a little exercises while you're still in the chair. Stretch your legs in the chair. March your feet on one spot. Slide your feet up and down your shin. Rotate your ankles. Let this body in your legs circulate while you're still sitting. If you forgot everything I just told you and you stood up and you feel dizzy, at least please remember that. If you stand up and you're dizzy, sit down. Don't start walking right away. If you sit down and you're still dizzy, try to lay down. Try to elevate your legs above your hip level. That can help. That can bring your blood pressure back to normal. If you stand up and you're dizzy, please move away from any dangerous objects, such as hot liquids, open fire, sharp corners. Stay close to soft chair before you know it is safe for you to start walking. So if you feel dizzy, grab some water, drink. Sit down, drink some water, then try to stand up, and you can walk if you don't feel dizzy anymore. So as I mentioned earlier, blood pressure can go up when you lay down for a long time, especially at night. So for patients with orthostatic hypotension, we do recommend that you elevate your head of bed by at least 30 degrees. Just using few extra pillows might not be enough. Put some wedge under the head of your bed. That can elevate the entire head of your bed, and that can prevent your blood pressure from going too high when you're sleeping at night. So what else can you do to help yourself, to help your doctor recognize that you have this problem? Create a habit of checking your blood pressure once or twice per week. Write down the numbers, and when you go to see your doctor, take it with you. Show it to your doctor. It will help us. If you change your Parkinson's medications or blood pressure medications, check your blood pressure a little bit more often, and check your blood pressure the way I just told you. Don't check it just sitting. That might not be helpful. Check your blood pressure sitting and standing. Write down those numbers. Let your doctor know if you see some problem there. Don't wait until your next appointment if it is 6 months from now. Don't wait for too long. We want to hear from you. We are here to help you. Let us know if you notice the problem. Now we use telemedicine more and more. It is helpful, it is convenient for us and for patients. However, telemedicine doctor cannot check your blood pressure. You have to do it. So if you have telemedicine visit with your doctor and you know you have orthostatic hypertension or you think you might be having it, please check your blood pressure before you talk to your doctor through video. It will be very helpful to us. So what else can doctor do if you have orthostatic hypotension? So first of all, we not necessarily need to start prescribing you medications. You might reduce medications that are causing decreased blood pressure. So your doctor might review the list of your medications and change something to keep your blood pressure from dropping down. We often recommend to our patients to try compression stockings that can reduce blood pressure drop without prescribing you additional medications. Abdominal binder is another measure we can use before we prescribe medications for hypotension. Salt pills, if you don't have any contraindications from standpoint of your heart condition, also can be helpful in patients with orthostatic hypotension. If this is not enough and your blood pressure is still dropping down, your doctor might prescribe medications. We do have 4 commonly used medications. We will talk about them. So those medications are fludrocortisone, midodrine, pyridostigmine, or droxidopa. Those are 4 medications your doctor might prescribe for treatment of orthostatic hypotension. However, also keep in mind, all of these medications can increase your blood pressure a little bit too high. So if your doctor prescribes those medications, you definitely need to continue checking your blood pressure and letting your doctor know if you see that your blood pressure is going too high. Fludrocortisone, this is one of our oldest medications for treatment of orthostatic hypotension. This medication is synthetic steroid or hormone, similar to natural hormone produced by your adrenal gland. This medication can affect salt balance in your body. It can make your body retain salt. By doing so, medication can increase volume of circulating blood in your body, and it can increase your blood pressure and prevent blood pressure from dropping down. It is once-a-day medication. It cannot be used in certain heart conditions, such as severe congestive heart failure. So therefore, your neurologist or whoever doctor prescribes this medication will need to take this into consideration. Midodrine is another medication we often use for treatment of orthostatic hypotension. This medication works by stimulating norepinephrine receptors on blood vessels, and that can cause blood vessels to tighten. By doing so, medication can increase blood pressure and prevent it from dropping down when you stand up. We do not recommend to take this medication too close to bedtime because remember, your blood pressure can go too high when you lay down and sleep at night. We recommend this medication to take no later than 3 to 4 hours before you go to bed. This medication needs to be taken 2 or 3 times a day. Some patients need to take it only as needed when they feel that their blood pressure is dropping down. This is our newest medication that we now have available for treatment of orthostatic hypotension. It's called droxidopa. This medication causes small increase in norepinephrine that stimulates receptors on the blood vessels and cause those receptors to tighten. By doing so, medication can increase your blood pressure. It is also 3 times a day medication. And finally, pyridostigmine. So this is the medication we have been using for many, many years for treatment of different neurological condition called myasthenia. This medication works at the level of autonomic ganglion. Ganglion is a collection of cells just outside the spinal cord that sends signals to blood vessels and cause them tighten when you stand up. Interesting observation was made that ganglions are more active when you're standing up. So therefore, this medication has the lowest chance to increase your blood pressure too much when you're lying down. Okay, to summarize what we just talked about. So I want to emphasize that orthostatic hypotension is a common condition in patients with Parkinson's disease. It is often unrecognized. It is often untreated for a long time. Therefore, it is important to know about this. It's important to diagnose patient if patient has this condition. Now you know how to check your blood pressure at home. So please do it, even if you don't feel you have it. Do it at least a few times and see if your blood pressure is dropping down when you change your body position. You know that orthostatic hypotension can affect your quality of life. It can be dangerous. Therefore, let's not miss this condition. Orthostatic hypotension often can be managed even without prescribing new medications, but it's important for us, for doctors, and for patients to know if you have it. And finally, if you do have severe orthostatic hypotension, yes, we can treat it. Doctors have medications that they can prescribe to help you to improve your quality of life. And that was all I wanted to share with you, and I will be happy to answer your questions.
Okay, welcome back. Thank you very much for being patient with us while we reset. We have been looking at your questions online, so I will be asking Dr. Waln to address the questions you all submitted. Since we are being responsible during the COVID pandemic, we will be masking when we're not talking, so just be patient with us as we accommodate that as well. But all right, we got lots of really great questions. The first one is, can you explain how an abdominal binder or compression stockings work? And does it matter if you use knee-high or thigh-high compression stockings?
That's an excellent question. Yes, so compression stockings and abdominal binder works almost like a shrinking your blood vessels. So when your blood vessels cannot shrink due to abnormal reflexes coming from your nervous system, compression stockings can help it. It can tighten your blood vessels a little bit, and it can push blood away from your legs back up into your upper body. It is important to wear full-length compression stockings if you can. It might be a little bit difficult to put on, but this is the ideal size, ideal length of compression stockings. They have to be full-length. Knee-high, if you absolutely cannot use full-length compression stockings, is okay to use, but we do recommend full-length compression stockings.
And the abdominal binder?
Abdominal binder, just routine abdominal binder. It also can tighten your body and push blood away from your lower body up into your full bloodstream. It is much easier to put on when you stand up as compared to compression stockings. So we do recommend either compression stockings or abdominal binder. Only for patients with severe orthostatic hypertension, you can use both. But also I want to mention, put compression stockings on when you're still in bed, then stand up. When you take a nap or you go to bed at night, please take them off. Do not keep your compression stockings on when you're planning to lay down.
Okay, thank you. This person submitted the question, I take very little Parkinson's meds. If orthostatic hypotension is caused by Parkinson's, does taking more Parkinson's meds help it? This person says she also has heart failure.
No, taking more Parkinson's medications will not help orthostatic hypotension. In fact, it might worsen orthostatic hypotension. If you have heart failure, we can still use some medications for you, but your neurologist, you might need to talk to your cardiologist and choose medication that will be safe for you. Most likely, we won't be able to use fludrocortisone, but you might still be able to use other medications for treatment of your orthostatic hypotension.
You talked a lot about hydration, but what if someone is resistant to fluid intake? Do you have any suggestions to encourage that, or any suggestions to address that?
Yeah, that question is obviously coming from a caregiver. Tell your loved one that doctor told to drink more fluids. So yes, we encourage the patient. Obviously, we cannot make them, but this is about your safety. This is about your well-being. This is about well-being of the loved ones around you. They want you to feel better. They want you to participate in family events. So please, it's a simple measure. Just drinking enough fluids can make your life so much easier. So please do it, especially when it's getting so hot outside.
Okay. Are orthostatic hypotension and postural orthostatic tachycardia syndrome related?
They are related to some extent. So orthostatic hypotension is blood pressure drop. Orthostatic postural tachycardia is changes in heart rate. Usually when blood pressure drops down, your heart rate goes up. Your body is trying to compensate for low blood pressure by increasing your heart rate. But in some patients, we do not see changes in blood pressure when you stand up, but only changes in heart rate. Those conditions are a little bit different, despite that tachycardia comes with orthostatic hypotension. If you do not have drop in blood pressure and only heart rate goes up, you do not need all those medications we just discussed. It's still advisable to drink more fluids because your body might change your heart rate because there's slight change in your blood pressure only. So by drinking more fluids, it might help orthostatic tachycardia as well. However, if you do not have drop in blood pressure, in addition to tachycardia, you do not need to take all those medications we talked about.
Okay, and then related to that, I was handed a note with a question that says, is a drop in pulse rate related to orthostatic hypotension? So blood pressure stays normal, but pulse rate changes.
No. Orthostatic hypotension is just changes in blood pressure. And again, like I mentioned earlier, so normally if your blood pressure drops down, your heart rate should go up. And this is what we often see in orthostatic hypotension. If your heart rate drops when you stand up, I would advise to talk to your cardiologist. That is usually not neurological condition. It might indicate that you have some underlying heart condition that needs to be investigated and treated.
Okay. Other than dizziness, what other symptoms of orthostatic hypotension should I be aware of?
Dizziness is the most common symptom of orthostatic hypotension. However, some patients just feel weak all over when they stand up and walk. They feel shaky in their legs. They feel that their vision is getting blurry or dark. They feel palpitations or heart racing. Those are also symptoms that might indicate you have orthostatic hypotension.
You recommended small but more frequent meals. And does that apply to people with Parkinson's who don't have low blood pressure?
It is recommended to reduce portions when you have Parkinson's disease because you might develop orthostatic hypertension. Up to 30% of patients with Parkinson's disease might have it. If you like large meals, if you have family barbecue and you don't have orthostatic hypertension, it's okay to have a large meal here and there, but it is recommended to have smaller portions, but more often meals.
What if I have low blood pressure all day, but wake up in the morning with very high blood pressure?
Please check your orthostatic blood pressure. If you have low blood pressure during the day but high at night, it means that your body might not be regulating your blood pressure with changes in body position. Like I mentioned during my talk, patients with orthostatic hypertension often have high blood pressure when they're sleeping at night, because your body does not regulate blood pressure while you're changing position. Please check your blood pressure. It's not just what you have when you're sitting. What's important to us, how much your blood pressure changes when you change your body position. So please today, go ahead and check your blood pressure when you're lying down, sitting up, standing up, write down those numbers and compare them. Also, please do so in the morning when you wake up tomorrow and compare your numbers when you change your body position. You might be having orthostatic hypotension if you wake up in the morning with high blood pressure.
So related to that, I'm going to skip to a question that asked how many times a day should someone be checking their partner's blood pressure? And there was a question about what is the best, is there a preferred arm cuff, wrist cuff? What's the best way what's the best device to use to take the blood pressure?
There is no preference in terms of devices, but at least once when you get new device to check your blood pressure, take it to your doctor's office and compare the numbers that you get from your device and doctor's device. Make sure that your device is well calibrated and gives you the correct numbers. So how often you have to check it, it depends on the presence of orthostatic hypotension. If you do have it, if it's severe, check it maybe 3 times a day. See what time of the day your orthostatic hypotension is worse. If you don't have orthostatic hypotension, you might be checking your blood pressure only when you change your blood pressure medications or Parkinson's medications. If you have light orthostatic hypotension, check it maybe once a day. So check it one day in the morning, the next day in the evening. So how often you will do it, it will depend on your situation and severity of your orthostatic hypotension.
Okay, you've talked a lot about diet and salt, including a salt tablet, but why does increasing salt intake increase the blood pressure, and how much salt how much salt do you recommend?
So it's a good question. So salt attracts water. So when you eat more salt, when you like salty food, you remember that you typically feel dehydrated and thirsty. You drink more water. So when you consume more salt, you're more likely to drink more water. And plus, when you have higher salt volume, higher salt level in your blood vessels, your blood will attract more fluids from the tissues through which this blood is flowing. So that's how salt can increase your blood pressure. So how often or how much you have to add salt? If your heart is healthy and if you have orthostatic hypertension, just extra pinch of salt to your breakfast and extra pinch of salt to your lunch might be enough. So you don't have to eat too much. You don't have to eat salty food if you don't like it, but just sprinkle a little bit extra salt to your meals. That should be enough to keep your blood pressure a little bit higher.
Okay, that's simple enough. The next couple questions are related to exercise. So if I have orthostatic hypertension when I stand up, will I also have problems when I exercise? And then also, does exercise help with blood pressure, or is it just something that's too dangerous to do if you have orthostatic hypertension?
So exercise might be good when you have orthostatic hypertension and not very good. So when you exercise, blood pressure goes a little bit higher normally. However, if you exercise too much, if you sweat, your blood vessels can dilate and your blood pressure might drop, especially after you exercise a lot and you start sweating. Moderate exercise is important for anybody with Parkinson's disease. So please do it unless you have severe orthostatic hypotension. Then unless your blood pressure is well regulated with medications, you might consider exercising in the chair. So once your orthostatic hypertension is treated and you feel better, you can go back to your exercise routine and exercise on a treadmill. But if your orthostatic hypertension is not well controlled yet, you might still continue exercising, but please do it in a chair.
Okay. This next question is related to a chair. This person has a favorite recliner and wants to know if that's considered, if just elevating legs in the recliner is enough for, when you talked about elevating legs as something someone could do, but is a recliner enough, or do they need to be laying flat in a bed with their legs elevated that way?
If your blood pressure drops down just a little bit, elevating legs will be enough. If you feel like you're about to pass out, your blood pressure drops down so much, it is better to lay down flat in bed and elevate your legs above your heart level. If you're just a little bit dizzy, sitting down in the recliner and elevating your leg above your hip level might be enough. Not so much when your blood pressure drop is very significant and you feel like you're about to pass out.
Okay. This one kind of relates back to the salt discussion. Does the type of salt you use matter, potassium versus sodium?
Sodium. Sodium attracts water, so it has to be our regular kitchen salt, sodium.
Okay. If somebody faints, how can you tell if it is a stroke versus a heart attack versus Parkinson's orthostatic hypertension?
If somebody faints, it should not be you who will be deciding one patient fainted. Especially it happened the first time and patient previously was not diagnosed with orthostatic hypertension. Please call for help. Call 911, take patient to the emergency room, and let us decide what happened to your loved one. So it can be orthostatic hypertension, but orthostatic hypertension can lead to decreased blood flow to the brain, and it might cause, in rare circumstances, it might cause some damage to the brain when you have additionally problems with blood vessels that send blood to your brain. So it is difficult to distinguish between orthostatic hypertension passing out and heart attack. So patients with orthostatic hypertension might pass out one day from orthostatic hypertension, and the next time it can be heart attack. So if you are not sure what happened, if you check blood pressure in your loved one and the blood pressure is low, and this is unusual for your loved one, it's better to call 911 and take patient to the emergency room and let doctors decide what happened. So if your loved one has non-orthostatic hypotension and you are well familiar with those syncopal or passing out episodes, you know what to do with it. You can put your loved one flat, elevate the legs, and see if your loved one wakes up. Also check his blood pressure to make sure that it is low blood pressure and not something else. However, even for those patients with non-orthostatic hypertension, passing out, falling down might be advisable to take your loved one to the emergency room and let doctors decide what happened. Let staff in the ER give them some IV fluids that can improve their blood pressure and help them.
Earlier, we were talking about people's hesitation going to the emergency room right now during the COVID issues. Still important to go to the emergency room in these cases, despite that.
If this is the first time it happened to your loved one, yes, please do not delay medical help just because you are afraid. So our ER staff, they are well familiar with all those precautions that they have to take into consideration while dealing with this pandemic. So please do not delay seeking medical help if you need it. Do not delay just because you are afraid. Our ERs are well equipped to help equally patients with the virus and patients with other medical and neurological conditions.
Okay. And then I think these may be the last two questions, which relate to kind of physician issues. One question is which physician should address the issue, and the other is someone being seen by a general neurologist who says that's not a Parkinson's problem, and they should see a cardiologist, but the cardiologist can't seem to figure out what to do next.
Ideally, it has to be cooperation between your neurologist and your cardiologist, but both specialties, cardiologists and neurologists, should be familiar with treatment of this condition. If you are not sure whom to discuss your orthostatic hypertension with, start with your neurologist, because neurologist who is treating Parkinson's disease is well aware, should be well aware of orthostatic hypertension and how often it happens in Parkinson's disease. If your neurologist does not feel comfortable treating this condition, cardiologists can do this as well. So we use the same medications, but ideally it should be cooperation between neurologists and cardiologists, and sometimes your primary care doctor as well, because like I mentioned during my talk, changes in medications that other doctors prescribe might be the first step to help you with orthostatic hypertension. I personally prefer not to change medications prescribed by cardiologists to treat your heart blood pressure without talking to cardiologists. If doctor feels you need medication to treat high blood pressure, I would prefer to talk to your doctor, discuss the situation, discuss the findings, new findings now that you have orthostatic hypertension, and find the best solution for you. It should not be just neurologists making such decisions. It probably should not be just cardiologists making such decisions. Ideally, I would like cooperation between different specialties when we are talking about you as a whole, as a person with multiple conditions.
All right. Well, that wraps up our question and answer session. Thank you all at home for submitting such wonderful questions. And thank you again, Dr. Waln, for joining us today and for giving this presentation. I know clearly a lot of people found it very helpful. Okay, so up next is our movement session with Pat Johnson. If you're not able to stick around to move with us, I just want to take a minute to thank you all for joining us and to again thank our sponsors for their generous support of our educational programs. This session will be available online in the coming weeks, and our August session is now open for registration. We will again be learning virtually, and we hope you'll join us for that. If you need help finding the handouts, you can find them online at hapsonline.org or by contacting the HAPS office, and someone will help get those to you. Now we're going to jump over to Pat Johnson in her private gym, so get ready to move. Pat Johnson is a native Houstonian who for the past 13 years has been a certified personal trainer who specializes in functional fitness and quality of life issues for older adults. I met Pat nearly 5 years ago when the stars kind of aligned, and she showed up on HAP's doorstep to talk about partnering to bring the Rocksteady boxing program to HAPS. Together, we built this outstanding Rocksteady boxing program that so many people have loved, and she is Rocksteady certified, and she's teaching our weekly classes, which she's still doing, though now it's virtually. So she's leading a group of folks as they're fighting back against Parkinson's. So we're going to turn this over to Pat. We will come back afterwards, and you will want to turn up the volume on your speakers for Pat's session so you can really hear what she's saying and really move with her. Thank you.
Hi, aloha. Welcome to my tropical paradise gym. Thank you, HAPS, for inviting me to be part of the summer lecture series. And thanks to each one of you who is joining to learn a little bit about boxing. You've probably heard from your neurologist or just in general that boxing is a really great exercise for people with Parkinson's. But do you know why? Well, there's several reasons that make boxing a great choice. One is, if done correctly, boxing is a very intense exercise. And intense exercise has been shown to slow the progression of the symptoms of Parkinson's. Also, just the mechanics of boxing addresses a number of the issues that you might experience with Parkinson's. It helps with agility, eye-hand coordination, mental focus and acuity, balance, flexibility, and eye-hand coordination. If you're actually hitting something like a heavy bag or a speed bag, then the impact is improving the bone density of your hands, wrists, and arms. Also, when you do the speed bag, you're improving your shoulder girdle, strengthening it, which also helps with your posture. So there's a lot of good things about boxing that can help you if you have Parkinson's. So before we start, I'd like to just warm up, get the juices flowing. So what you're going to do is big, floppy arm circles. Now keep those shoulder sockets really loose and just let them flop. And then let's reverse them. Good. And now I want you to do what we call in our class social worker hugs. And each time you slap across your chest, you're alternating which arm comes above, which arm goes below. Big loose ones. Don't contract the arms and your shoulders, don't contract the muscles in your arms or your shoulders. And now we're going to do Maypoles. So a Maypole, you're going to keep your hips stationary and you're just swinging your arms and twisting from the waist, working on that mobility of the torso. A few more times. And then let's work out the flexibility of our wrist just a bit also. So first I want you to do a wrist flex. Flex down, flex back, down and back, down and back. Give me a few more. And now let's go for wrist rotations. Try to isolate and also exaggerate that movement. So you're really working on that wrist mobility. And now let's just reverse it. Good, I think we're ready to start. So my goal with you today in this lab is just to teach you enough boxing to make you dangerous and also to have something that you can take with you after today and do at home. So I'm going to be teaching you all the basics of boxing. One of the things that's so great about boxing is you don't have to even stand up to do it. You can actually be seated in a chair or a wheelchair, and if you put your all into it, you still get a great workout. So let's start with the most basic thing, which is your stance. So your stance, if you're right-handed, which most people are, is going to be left foot forward, and then my right foot is back diagonally. Why do I do that? Because if I brought my right foot directly behind me, that is such a narrow base of balance that it's extremely unstable. One hard breath and I could fall over. So we slide that leg out so that it's back but diagonally. Now, if you're left-handed, you're just going to reverse that. So your right foot will be forward, and that left is back on a diagonal. So you probably noticed that the back leg is always the leg that belongs to the dominant side. And that's how you can remember which leg goes back. Okay, we've got our feet, which are very important. There's an old saying in boxing that boxing starts at the feet. And when I begin to show you these punches, you'll see that that's 100% true. So you've got to start your base correctly. Now, what do you do with your arms? All right, I want to have my arms up right here. I call this home base. So my fist should be at my jawline. If I'm not executing a punch going out or coming back, this is where they are at all times. Why? Well, if you are actually sparring with an opponent, having your elbows in like this protects your ribs. Having your hands up here is going to protect this whole area. You don't lose teeth, you don't break your jaw. It's the way to go. So you will always return to home base. So we're going to learn 4 basic punches today. The punches are jab, cross, hook, and uppercut. There's combinations that are done that are called in boxing, and each punch has a number that defines not only the punch itself, but which hand you do it with, whether it's dominant or non-dominant. This becomes a really valuable asset when you have Parkinson's, because in my Rock Steady classes, we call combinations for our boxers. It might be 1, 4, 5. So when they hear that combination, they have to translate it as it goes into their brain. 1, 4, 5 means jab, right hook, left uppercut. Okay, now I have to recruit those muscles to do that and then execute it. It's a brain drain. It's a great challenge, and it really helps with mental acuity. So let's start with our very first punch. I'm going to pretend I'm a right-hander, even though I'm really a left-hander. And so I'll show you the punches as a right-hander, but all you would do is reverse it should you be a left-hander. So the first punch, which would be number 1 in that combination, is your jab. Your jab is your setup punch. It's where you figure out where your opponent is, and then it's how you annoy or distract your opponent. It's typically not your hardest punch. It can be hard, but it's not. Sometimes it's just a little boop, getting their attention and distracting from what you're getting ready to do. Now watch my form on this. Start at home base, and now I'm going to bring my arm all the way out. My knuckles are horizontal to the floor. My palm is down. And most importantly, do you see how straight my arm is? If I deliver that punch with a bend in my elbow, guess what? I've lost 40 to 50% of the power of that punch. So I always want a straight arm. Now, remember I said that boxing starts in your feet? It certainly does. So watch what happens down here. There's a party going on downstairs also. So I start here in my home base, and as I extend my arm out for the punch, I shift the balance to the ball of my foot, and my hip moves forward and back. And then you have power in your punch. If I'm just doing this, I'm not going to have much. So let's try that together. Remember, if you're right-handed, your jab is going to be your left, and if you're left-handed, your jab is going to be your right hand. So get in your position, home base. Let's do 8 of them. Are you ready? 1, 2, 3, 4, 5. Move that body. 6, 7, and 8. Great. Now we're going to do the second punch, which is the cross. The cross is actually the exact same thing as the jab, except it's done with your dominant hand. You know, in this world of great uncertainty, it's so wonderful that we have a few things that are always certain. One is your jab will always be your non-dominant hand. The other is your cross will always be your dominant hand. Isn't it good to know something doesn't change? So we're going to do the exact same punch, only we're doing it on the right side. That's our dominant side. We're much stronger on this side. So this is your knockout punch. This is the big boy. So again, I start here at home base. Be sure and watch what happens down here. The party starts down here and goes all the way up. Boom. Boom. Arm is straight, knuckles horizontal to the floor, palm down. Look what happened down here. Weight is shifted forward, heel is up. I'm able with that heel up to drive my knee and hip forward to power that punch. So let's do 8 of those. Remember, if you're right-handed, your cross is going to be number 2 in the combination. Number 1 is your jab. Number 2, your cross. So let's do 8 of those crosses. 1, 2, 3, 4, 5, 6, 7, and 8. Good. Okay, now you're getting a feel for it. You already know 2 punches. Now we're going to go to our hook shot. Now the hook is a close-in shot, and typically when you see it in a boxing match, you'll see that somebody has hit from the side of the jaw or right down here. So it's a head or a body shot. But we're just going to call it the hook right now. So your left hook will be number 3 in your combination. Let me show you how it's performed. So you're still in your boxing stance, start at home base. Here's what happens, because we want to keep everything in close. So when I'm going to do my left hook, I elevate that left elbow. When I do that, I bring my wrist around so that now my knuckles are vertical to the floor, my palm is facing me. This is where we really have to get our body involved, or we got nothing on this punch. So watch what I do. So I'm going to bring my elbow up, get my wrist and palm in place. I drop back slightly and come around. Boom, boom. By lifting my heel and coming up to the ball of my foot and my toe, that allows my knee and my hip to make the movement that puts the power in that punch. So this is number 3, my left hook. Let's do 8. 1, 2, 3, 4, 5, 6, 7, and 8. Can you guess what number 4 in the combination is? If you guess right hook, you'd be correct. So the right hook, exactly the same as the left, except on the right hand, or the dominant hand. So check our feet, they're still good. Get back into our boxing stance. And now I'm going to elevate the elbow. My knuckles are vertical to the floor. My palm is facing me. So I drop back and twist. Remember, the party starts in the basement and goes all the way up. So do 8 of those with me now. This is number 4, your right hook or your dominant hand hook. Here we go. So I lift that elbow and twist. Always returning back to home base between each one. 4, 5, 6, 7, and 8. Great. Okay, now I'm going to teach you the most dramatic of all the punches. It's called the uppercut. If you've ever seen a Rocky movie, you've seen an uppercut. So imagine the scene where Rocky is just about out of gas. He's in the corner. You figure he's going to lose this match. The big dude is beating him up. And all of a sudden, Rocky drops back, comes up under the guy's chin, hits him with all of his strength. The guy flies back. Slow motion cinematography of saliva and sweat fly across. The guy goes back, hits the floor, down for the count. Rocky wins. That's the uppercut. So when you do the uppercut, you're still in your same boxing stance. Start with home base. Now, this is the one time you are going to actually drop into your heel for a minute. And when you do, keeping your elbows in, now my knuckles face the ceiling, my palms still face me, just like they did with the hook. Now, my left uppercut, or my non-dominant uppercut, is going to be number 5 on the combination. Watch how it goes. Drop back a bit, down and back, and then I drive up. Imagine that guy's chin, and you want to get up under it. And the power comes from low to high, driving your weight up. Let's do 8 of those. Ready? Here we go. Home base. Drop back. Boom. 1, 2, 3, 4, 5, 6, combination? Yes, it is your right or dominant arm uppercut. So this is a very powerful one. This is probably the one Rocky used to knock the guy out, I'm guessing. Back to home base. Again with this one, my knuckles face the ceiling, my palm faces me, my elbows in protecting my ribs. So again, I drop back into my heel, down, drive up, down, drive up. Boom. Let's do 8 together. Ready? 1, 2, 3, 4, 5, 6, 7, and 8. Guess what? You now know almost everything I know about boxing. Congratulations. So what I want to do now is try the whole combination. Let's see what happens. Nobody else is watching, so you're fine. Go for it. So I'm going to remind you, 1 is your non-dominant jab. 2 is your dominant punch cross. 3 is your non-dominant, probably left hand hook. 4 is your dominant, probably right hand hook. 5, left or non-dominant uppercut. 6, dominant or right uppercut. Are you ready to try it with me? Give it a shot. Let's go. Okay. 1, 2, 3, 4, 5, and 6. Let's do it again. 1, 2, 3, 4, 5, and 6. Again. 1, 2, 3, 4, 5, 6. One more time. 1, 2, 3, 4, 5, and 6. Woo! You see what I mean? That's aerobic activity, isn't it? So, one more thing I want to show you is a shadow boxing form of speed bag. Speed bag is this little guy right here. It's a tear-shaped bag. And the way you hit it, now your feet are in parallel. And you're going to lift your arms to 90-degree elbows. They remain there throughout the whole practice. Your hands, when you hit, are different. You don't hit with your fist when you're doing speed bag. You hit with the side of your hand, that little meaty part right there. So you're going to line your hands up, make a fist, and now I just want you to motorboat and just rotate one around the other. That's right. Go as fast as you can, but try to keep the pace. Whatever you're doing, keep it. Now, I want to make sure you're not rotating or orbiting just one around the other. This is both hands moving equally. Don't stop. Your elbows really want to drop. Tell them no. Now let's reverse. Keep that pace though while you're hitting. Reverse and go the other way again. Yes. How are your shoulders feeling? See what I mean? All right, now let's throw one more thing in. We're going to multitask. So we're also tapping from side to side. If you're in a chair, just simply tap from side to side with your foot. Let's go. Keep going. Come on. We've got 5 more seconds. Keep it up. Keep it up. Keep it up. Good. I don't know about you, but my shoulders are burning. So you can see that even without a speed bag, you can get a lot out of that. So my hope is that you will take the information that I've shown you here today and start a practice at home. If you did 2 to 3 times a week, 10 or 15 minutes, and you could do it in front of a mirror if you're shadow boxing. If you have an actual bag to work on, that's fantastic. And there's a third option. If you have a willing, well, let's not call them victim, willing helper, have them hold a thick cushion. You wouldn't want to use a pillow from your bed or a small throw pillow. That's not enough padding. You need something like the base cushion of a sofa or an easy chair, something like that. So they would brace themselves and hold it in front, and then you can do your boxing. You'll be really surprised at how much you can get out of that and how exhausting it is. Now, if you're doing it with the cushion or a bag, you'll want to wear gloves, gel wraps or regular wraps, and a glove. So now you know how to box. I know when you start at home, you might think, oh gosh, what was the hook again? Well, the good news is, if you go to YouTube, there's probably 10,000 or more videos on how to box, boxing punches. Type in something of that nature, and it can just refresh your memory of what we did here today. So I thank you so much for joining me, and I hope you stay safe and healthy. Back to you, Kathleen.
Wow, thanks, Pat. That was great. We appreciate the energy that you bring to this group every week. Well, that wraps up July for us, so we will see you again August the 15th for our final session of the series. If you're looking for something to do in the meantime, visit us at hapsonline.org, see our monthly calendar, and join a weekly live exercise class via Zoom. We look forward to being back with you in person as soon as the time permits. Until then, we appreciate you joining us. We thank again all of our sponsors. We thank you, and we thank our presenters for today. So see you in August. Bye-bye.